Hello, Kate.
Hello.
Hi, my name's Sarah. I'm looking after you today. So welcome to the ward. You're on ward 4 now, which is on the 2nd floor. You probably didn't know where you were. You came up in the chair. So congratulations, you've done really, really well.
Thank you.
Are you feeling okay?
Yeah, fine.
Good.
Yeah, thank you.
If you need anything, you've got this call bell. When you first arrive on the postnatal ward, we welcome you and show you to your bed, show you the layout of the ward, talk to you about baby safety, not to leave your baby unattended on the bed, show you the bed cot, how things work, the call bell, there's a bedside TV, there's iced water as well, and then we put labels on your baby and a security tag, and if you leave the ward without the special pass, then the alarm will go. But what this is showing you is all the things that have to happen to help you before you go home. The yellow folder, there's one at the end of each bed, and inside there is all the ward information that you require for your stay while you're with us. And it tells you about care of your baby, what to expect, how to breastfeed. You need to bring all your things for you in an overnight bag, so your toiletries and clean things for yourself. At the bedside there's a locker, so you've got somewhere to put your things. You need to bring baby grows and vests and nappies for your baby, at least 4 changes of clothing and plenty of nappies. If you're formula feeding your baby, then bring your chosen formula. Your partners are welcome. We have open visiting all day for your partner from 9 AM until 8 in the evening. Visiting is restricted though for other members of your family for between 3 and 4 in the afternoon and 7 till 8 in the evening. The problem is newborn babies need lots of feeds. They need lots of close contact, and if visiting is open throughout the whole day, this can affect how often you feed your baby.
How do you feel about, the prospect of breastfeeding, anxiety-wise?
There is an antenatal workshop held here at Birmingham Women's Hospital every Thursday, and if you're interested in finding out how to get going and get started with your breastfeeding, find out what it's all about, please come along. Lunch is served at 12 and it's a hot meal service served on the ward, and we let you know when it's here. You can come and select a meat option or vegetarian. And then food comes again at 5 in the evening. There'll be another choice, maybe a baked potato and a sandwich option, something like that. The midwives' uniforms are navy blue, like this one. The midwifery assistants who are here to help you care for your baby wear a grey uniform. We have bed coordinators and discharge planning coordinators to help you get home again and to prepare your paperwork for you. These wear light blue coloured uniforms. The ward layout is bays with 4 beds in, and we have side rooms as well. She needs to be nose to nipple. The chin touches the breast first. She opens her mouth wide. When you see that big wide mouth, with this hand, bring her to you. Well, the first thing that happens when you've had your baby is that we place your baby skin to skin, and this is really good close early contact and can start the baby feeding straight away. For support for your breastfeeding when you're with us, we have an infant feeding team, and the infant feeding team are available to help with support on the wards, but really our remit is that all of our staff are trained. All of the midwives and midwifery assistants who are in daily contact with you have had training and can support you with your breastfeeding.
She's on there, but she's not sucking or anything like that. So what we'd say is, just tickle her feet a little bit and just try to wake her up, try and get her interested.
Although we recognise that breast milk is preferable for your baby, if you have decided to formula feed your baby, then we ask that you bring in your own formula. We label it with your name on, and we have a fridge where you store your milk. Now, if your baby's on the neonatal unit, you probably would like to express your breast milk for the baby. So there are staff downstairs to help you. There is a lactation consultant, a feeding specialist, and they will help you expressing your breast milk. A quick overview for you of a day on the ward would be in the morning, have your breakfast. This comes back 7:45, and then midwife will come and check you and your baby are well.
There you go, and this is Cheryl, and she's going to be the one that's giving your check. Later on, a hearing technician would come and listen to baby's ears, and then later on she would come down to baby clinic. It's a little top to toe check, which includes baby's eyes, heart, and a little overall to see if baby can go home.
So we've got some painkillers for you as well in the cupboard. So we're just waiting for these results and then we can get everything ready for you and you can go. Okay.
We have to make sure before you discharge that there's no underlying medical problems that may need following up. No blood results outstanding, any appointments have been made. We need to make sure you've got the correct medication to go home if you are taking medication home with you. With breastfeeding mothers, we do like to check and make sure that the baby's correctly latching on and breastfeeding. We can tell that the baby's getting a good feed or not. With the caesarean section, possibly the stay could be 2 to 3 days, but again, it depends on why the section was performed and how they're dealing with the pain and everything afterwards as well. The transfer lounge, if you was ready to go home, you don't really need to be sitting in a bed, so we thought we'd find a nice comfortable space you could come to sit quietly, watch the TV, listen to the radio. Once I give your notes back to the midwife, she will go through with you all the contact numbers for anything that you may need. She'll go through alert signs with the baby. She'll let you know when your midwife will be actually calling on you. And basically, whatever you feel worried about, there is somebody and a number you can always contact.